All right, it is 5:30 on Tuesday, which means it is time for the Woodlands Plastic Surgery live stream Ask Me Anything. Your opportunity to go live, or we'll also archive it every week so you can access old videos and old streams. But anyway, it's opportunity to just kind of get live access to a board certified plastic surgeon, ask any burning questions on your mind related to plastic surgery. The more interesting or quirky, the more fun it is. It doesn't need to be all, specific medical questions and things like that. If there's a celebrity job you're curious about, or surgery, whatever it is, it's, an episode of Nip Tuck, whatever you want to talk about, by all means, ask any question you want. It's intended to be kind of fun and entertaining and all that. So I've got a couple questions people had emailed us with, so we'll kind of go to those first. If anybody tuning in decides to ask something live, we'll get to it if we can, or we can answer it next time. So starting off at the top, we just had a general question about Selfina. I guess somebody replied to one of our previous posts. So Selfina is the latest FDA-approved treatment for cellulite. It's an excellent technology. I'm really excited about it. It's extremely effective. It works really well. People have been very happy with the results. I've been extremely impressed with the results. It is excellent at what it does, but people tend to misunderstand it for having more capabilities than it really does. So Selfina is very much a treatment just for cellulite. And so it's not an anti-aging treatment. It's not a skin tightening treatment. It's not a fat reduction treatment. It's very specific to cellulite, but it's also very effective for cellulite. With cellulite, the classic cellulite, true cellulite, is that dimpling of the skin that you see in typically the buttocks and thighs. It's usually made worse if you're sitting. And so what Selfina does is, it's an office-based procedure. It takes probably about 30 to 45 minutes, depending on how wide an area that we're treating. You're completely awake. You have no pain during the procedure. And recovery-wise, you'll have some bruising and some swelling. And most people describe it as soreness, basically the technology is, it's a technology where you basically introduce a tiny little needle to basically nick or cut that little fibrous band that connects the cellulite down to the underlying muscle, essentially. And so it basically snips that little fibrous band, it releases the fibrous connection, and then that dimple pops out. So it's pretty fun because you do see results right away. It's similar to surgery in the sense that you'll see some immediate changes, but the results mature over time. And so commonly what happens is you see an immediate result, you're like, whoa, this is like a ton better. And then some of the swelling goes away, and then the results mature over the course of, I'd say, every 3 months, the results get better. Another common question is, how long does it last, which I think is important to know. We're not supposed to say permanent, but it's effectively permanent. So, our 3-year and now going on 4-year data demonstrate the results to be durable. And so as long as you maintain a normal weight, as long as you haven't gained or lost a bunch of weight, the expectation is that the results will last for years and years. And this is intended to be a one-time treatment. You just come in, you do it, you're done. So it's an excellent technology for that reason. Let's see. What is the difference between Define and Refine? So Define and Refine are two of the newer fillers on the cosmetic line from Restylane or Galderma. Galderma is the parent company that brings you Restylane, Refine, Define. They bring you Dysport, bunch of products. So Refine and Define are two of the later innovations in filler technology. They are both hyaluronic acids, or HA products. Hyaluronic acid fillers are the bread and butter of what we use these days for fillers. There are other technologies and other injectables that are available that are all effective and have their role. But most commonly is going to be hyaluronic acid. That includes your Juvederm, Voluma. All of these are hyaluronic acid-based technologies. Define and Refine, what this innovation represents is basically attention to animation and dynamic movement. So, some people complain, or they notice people they know or celebrities or whatever, that people kind of look weird when certain areas are either injected or over injected. And so the most common area that people can have issues where it doesn't look quite right is around the mouth, because the mouth is such an expressive area when we smile, when we speak, when we drink, when we take a sip on a straw. It's a very dynamic area. Our face changes a lot in that area. And obviously all the still photographs that you see on websites, social media, etc., it just shows things at rest. And that's a common problem with facelifts, which is a whole other topic of conversation. But you can see patients where they look okay when it's a completely still photograph, but the minute they smile or speak, it's like, what's going on there? And so anyway, Define and Refine, but they've developed a mechanism of cross-linking effectively that allows greater elasticity of the product to behave more like a rubber band. So it can, if you have a sphere, you can picture it pulling apart and becoming cigar-shaped and then snapping back together. And so when you smile, it will move more naturally in those natural skin lines, but still maintain its shape so that it can, again, spread out, come back together, spread out, come back together. The Define product is a little bit firmer, denser, a little bit more aggressive of a product, and that's for more deeper lines. So you can remember that by thinking Define, deeper lines. Refine is a little bit of a finer, softer product, and so for more superficial or finer lines, you'll want to use Refine for that. But both very good products. I've been very happy. When they came out, I'm not sure how long ago. It's been at least a year, maybe 2 years. But yeah, I've been very happy with it in my practice. So let's see. Can you do a rhinoplasty with a septoplasty? Yes, and in fact, it's encouraged. So if you need a rhinoplasty, if you need a septoplasty because you're having breathing issues, you're obstructed, you broke your nose, you can't breathe out of one side of your nose, whatever it is. So if you have some obstructive problem and you're also interested in getting something cosmetic done, it completely makes sense to do it at the same time, and you absolutely should do them at the same time. The reason why is that the septoplasty procedure and technique dovetails very nicely with rhinoplasty techniques. In cosmetic rhinoplasty, we very often use cartilage grafts to shape, structure, and support the nose. And the nasal septum is the most common place we get those grafts from. And so having that septum available and untouched by other surgery is helpful from a cosmetic standpoint. And then from a functional standpoint, it's basically a 2-for-1, where we can remove that deviated septal cartilage instead of throwing it in the trash. We don't actually throw it in the trash. We send it to pathology to be disposed of appropriately. But anyway, dispose of it. Instead of disposing of it, we can harvest it, use it, manipulate it, and then repurpose it to reshape the nose, provide projection, provide tip support, whatever you want to do. So very synergistic operation to do septoplasty with rhinoplasty. And then just make sure that you're going to a surgeon that is competent in both of those skill sets. Obviously, as an example, and I'm being extreme for sake of illustration and for sake of education, but obviously there's going to be, these are not absolutes. But on the ENT side, every ENT doctor can do a septoplasty. Not every ENT doctor, ear, nose, and throat, not every ear, nose, and throat doctor can do a cosmetic rhinoplasty. Similarly, not every plastic surgeon can do a rhinoplasty either, but certainly not everyone that is a plastic surgeon is trained to do a septoplasty per se. And rhinoplasty is one of those niche operations where you really want to do a lot of research into who you track down and who you find to do your rhinoplasty. It is very much a specialized niche operation, and you want to go to somebody that's part of their practice, that's part of their expertise. Put another way, you don't want to go to somebody who just kind of dabbles in rhinoplasty. You definitely want to be going to somebody who does it a lot, who likes it, and that's part of their practice. And so most of those people who would consider themselves rhinoplasty surgeons like myself, 99% of 9 times out of 10, they're going to know how to do a septoplasty as well and treat those functional things. I think the last comment to make on just that relationship also in terms of synergism and all that is that septoplasty is often covered by insurance. So if you have health insurance, and we all should, typically that portion will be covered by insurance. And so that does help with the cost of everything, obviously, and so it can help split some of the costs in terms of the anesthesia, the facility fees, reduce some of the surgeon's fees, or redistribute them to the insurance company and things like that. And so, again, it is just a very synergistic process to kind of do those things together. Let's see, and let me kind of scroll through here and see what else we have going on. So we had a question about facelift versus mini facelift. It's kind of a big topic, only a couple minutes left. I'll kind of introduce the basics of it, and then maybe in a future episode we can go into more details about it. Facelift is one of those operations where there are a dozen different variations on a theme. Just to answer the question, a true mini facelift refers to keeping the incision just in front of the ear, so it's a much shorter incision, but it's a much more mild result, and it's for people who are, say, 40 to 45, who have a little bit of skin laxity where they feel like things are starting to droop a little bit, but they don't have really heavy jowling down here. They don't have a really bad neck. They overall look quite good. They just feel like they look a little older than they want. And so a mini facelift is a good approach to basically focally tighten things in kind of the cheek area, get rid of a little bit of extra skin. But it's not going to be as aggressive as a full facelift. A full facelift is something that will treat all of the skin, all of the extra skin there. It's going to aggressively define the jawline. It'll get rid of jowling. It includes the neck, will retighten the neck. And then the incision does, because of all that, it extends in front of the ear, behind the ear, and then some variation into the hairline, essentially. So again, a very big topic, very complicated topic, but that's the basic gist. And so, patients, the last thing I guess I would say is that patients, it's human nature to read and do research and hunt on the internet and look at results and all of that. And so just like people go to WebMD to try and diagnose if their kid's got an ear infection or whether they've got asthma or whatever, you do your best, do your research and all that. But at the end of the day, I mean, that's where the training and the education and the experience and the surgical acumen come in, is determining what is your goal, what are your priorities, and then it's my job to figure out which route we take to get there. And so people understandably see a nice result, they see a short scar, they hear the word mini, and they think, I want a mini facelift. Again, natural and intuitive, but ultimately what the question is what is your goal? What are you trying to fix? What are we trying to improve? How do we want to look when we're done? And then that's where the education, expertise, and experience come in to figure out the best pathway to get there. It could be a mini facelift. It could be a mini facelift with some fat grafting. It could be a combination of non-surgical treatments with surgical treatments. It could be a full facelift. It could be any number of things. And again, that's where the experience and expertise come in, is in determining which tool is going to get us from point A to point B. So I think that's it for today. We've covered most of what was sent in, and if anything else pops up, holler at us. You can direct message us. You can follow us. You can send us emails, call the office. So we're always available. Again, ask whatever questions you want. The more fun, the better. Like I said, ask about celebrities, ask about an episode of Nip Tuck. I might have to have a heads up on that to research it and figure out what it is, because I don't know all that stuff off the top of my head. But anyway, over and out. Have a good week. I hope everyone's recovered from the storm, and glad to see we've got perfect weather again. All right, bye-bye.